Welcome to the deep dive. Today we're really looking at something that's absolutely key in healthcare, but maybe doesn't always get the attention it deserves. Following up on medical test results. It's, that connection between getting the data and actually knowing what it means for your health.
Exactly. I mean, think about it. The test itself, that's just one piece, like the first piece of a puzzle.
Right.
The follow-up is where you actually start putting it together, seeing the bigger health picture. And it's a point where things can easily get missed.
Absolutely. And to really understand this, we've looked at quite a few different sources. We've got insights from the big names in Healthcare Accreditation Joint Commission International, Indies, and ABH.
The gold standards, really.
Yeah. And practical advice from Supreme Medic, you might know their Lifelines work. And also observations from HospiMatch, that's an industry blog, plus some articles digging into this shared responsibility, between patients and the system itself.
And it's really interesting, isn't it, how all these different voices kind of point to the same thing.
Yeah.
How important this step is. You've got the accreditation bodies setting standards, the consultants giving, practical tips, and then the industry folks talking about what actually happens day to day.
So the big question we're diving into for you today is, well, have you ever really stopped to think about what happens with your test results once you've, left the clinic? This deep dive is going to sort of map out that journey. And maybe more importantly, give you some tools so you can be a real active partner in your own healthcare. Okay, so let's just jump right in. Why is following up so critical?
Well, like Lifelines puts it, and it's quite simple, really. A test is not the treatment.
Right.
It's a tool, right? Not the fix itself. The follow-up, that's where the tool gets used to make decisions about your care. Make sure you get advice promptly, that the right steps are taken. Without that, things can just drift. Conditions might worsen.
Like having that weather forecast you mentioned earlier, knowing a storm's coming, but not actually doing anything about it.
Exactly. The information's useless without action.
And it's not always about bad news, is it? Sometimes results are just unclear.
Precisely. Yeah, a lot of results aren't black and white. They might be inconclusive, maybe need another look, or, they have to be understood alongside other tests or your overall health situation.
Okay.
So the follow-up is the chance for your doctor to clear things up, order more tests if needed, and just get a fuller picture of what's really going on.
And without that conversation, that follow-up loop, it feels like the risk of something getting completely missed is, pretty significant.
Oh, absolutely. Missed results, communication failures, that can lead to delays in diagnosis, delays in treatment. It happens. All our sources really stress this. Being proactive about follow-up. It's like a safety net. It stops those crucial bits of info just falling through the cracks. And think about it from your perspective. The listener, you put in the time, maybe the money, to get the test. If you don't follow up, you're basically losing the value of that first step.
Okay, so let's get specific then. What are some of the common mistakes people make here? And, what are the knock-on effects?
Well, one of the biggest ones definitely is assuming no call means good news.
Yeah.
I can see that.
People get tested. They don't hear back. They think, okay, all clear. But that can be really risky. Results get delayed sometimes. Lab issues, admin errors. Maybe the clinic's just swamped.
Yes.
Our sources also mention people taking results straight to the pharmacist, not the doctor. Or the classic, trying to diagnose themselves online.
Oh, Dr. Google. It's so tempting, isn't it? I mean, who hasn't done that late-night search trying to figure out what some number means?
It is tempting, but, while looking things up online can give you some background, it just can't replace a proper interpretation from a professional who knows you.
Right, your context.
Exactly. Other mistakes. Just filing reports away without looking at them, forgetting follow-up dates, even losing the reports altogether. And the consequences of these. They might seem like small things, but what can happen?
They can be pretty serious, unfortunately. The sources talk about things like wrong medications being given because results were misunderstood, or missing really important early signs like, prediabetes, kidney problems starting, infections.
Wow. Yeah.
And just ultimately wasting time and money on tests that didn't actually lead anywhere helpful.
Okay, so this really drives home why being active about follow-up is just essential. Let's talk practical steps then. What can listeners actually do to make sure follow-up happens effectively?
The number one thing really starts right when the test is ordered. Just ask your doctor, point blank, okay, when and how should I follow up on these results?
Simple as that.
Yeah. Just clarify, is it another appointment, a phone call, a message through a portal? What's the likely time frame? Asking that one question can cut down so much anxiety and prevent delays later on. It's a really good safety check.
That communication piece feels huge. What about keeping track of the reports themselves? That can be a challenge.
Organization, yeah, it's key. Our sources suggest setting up one system. Maybe it's just a physical folder, nice and simple. Or maybe a secure digital app. Lots of options there now.
Like Garage Set To or DigiLocker, maybe?
Potentially, yeah, or specific hospital apps.
Really?
The main thing is to label everything clearly: date, test name, doctor who ordered it. And crucially, when you go for that follow-up, bring your old reports too, if they're relevant. Comparing over time gives so much context.
Makes total sense for spotting changes.
Yeah.
And the timing of the follow-up itself.
Try to stick to what your doctor advises. Now, the sources give some general ideas like maybe same day for urgent things like an ECG, 1 to 3 days for routine bloods, maybe a week, or 10 days for biopsies or cultures.
Right.
But your doctor knows your specific situation best. Definitely rely on their advice. And maybe set a reminder on your phone. That always helps me anyway.
Good tip. Okay, so you've got the report. Maybe you're looking at it before your appointment. How do you understand it without, freaking out or deciding you need surgery based on one number?
Yeah, avoid that. It's okay, like we said, to maybe Google some terms just to get familiar. But always remember, only your doctor can put those results into context for you, considering your history, your symptoms, everything, even if you can see your results in an electronic health record, which is great.
Yeah, that access is helpful.
It is, but it's not the same as talking it through with your doctor. One practical thing you can do is look at the reference ranges usually printed on the report.
The normal range.
Exactly. It gets you a general idea. But again, whether your specific result, even if it's slightly out of that range, is significant. That needs a professional call.
Got it. So when you're actually in that follow-up conversation with the doctor, what questions should you be ready to ask? How can you be, an active participant?
Don't be afraid to ask really direct questions. Things like, are these results normal for me? What does this specific number mean for my health? Do I need to change anything? Medicine, diet, lifestyle? And definitely ask, when should I get this test done again?
Right. Be proactive.
Exactly. Making sure you understand the findings and what comes next. That's the goal.
And what if? What if you leave that appointment still feeling unsure? Or maybe the results suggest something quite serious, and you just want another perspective.
Getting a second opinion is completely okay.
Good to know.
Yeah, it's often a really good idea, especially if it's a major diagnosis, or if you're just not comfortable with the plan, or you feel something wasn't fully explained. Asking for a referral to a specialist is perfectly reasonable.
Okay. So we've talked a lot about what we as patients can do, but what about the other side? What's the healthcare provider's role in making this whole follow-up process work smoothly?
Well, providers definitely have a big responsibility here. Clear communication is paramount. They need to communicate the results clearly in a timely way and give really explicit instructions about what needs to happen next, the follow-up actions.
So not just handing over the numbers, but explaining what they mean and what to do.
Precisely. And that means actively notifying patients, maybe a call, a secure message, setting up that next appointment, whatever works for their system.
It really does come back to that clear communication channel.
It does. And beyond individual doctors, healthcare organizations, hospitals, clinics, they need solid policies for this.
Yeah.
Especially for abnormal results.
Right. Critical results.
Exactly. And also during those handover points, like when a patient leaves the hospital, they also need systems to track tests just to make sure nothing gets lost in the shuffle.
Thinking about the whole system, what are some of the bigger challenges? Why does follow-ups sometimes fall through the cracks despite everyone's best intentions?
Yeah, the system itself has some weak spots, those transition points we mentioned, like hospital discharge. That's a big one.
Information getting lost in translation?
Kind of. Or just not clearly passed on to the patient or their regular doctor. Another issue can be incomplete electronic health records, or records that don't talk to each other between different providers.
The interoperability problem.
Exactly. That lack of smooth communication between different doctors or clinics can really hinder effective follow-up.
It sounds like sometimes the different stages of care aren't always perfectly connected.
That's a good way to put it. And this is where those accreditation bodies like JCI and NABH come into the picture, indirectly at least.
How so?
Well, they don't necessarily dictate exactly how every follow-up should happen, but their whole focus is on continuous quality improvement, patient safety, best practices.
Setting a standard.
Right. They push organizations to build better, more reliable systems overall. And that includes things like communication and tracking, which helps support better follow-up, even if it's not the only focus. They set benchmarks for quality that encourage better coordination.
We've talked a lot about following up on results that are, worrying or need action.
Yeah.
What about the normal results? Is it still important to follow up then?
Yes, absolutely. A normal result isn't nothing. First off, it tells you what you don't have, right?
Yeah, that can be a relief.
Huge relief, peace of mind. Second, it sets a baseline. Really important for comparing future tests, seeing if anything changes down the line.
Okay.
And sometimes a normal result means your current treatment is actually working well. So that follow-up conversation confirms that, clarifies the plan, maybe just keep monitoring, maybe no action needed right now, but you get that closure.
That closure, yeah, that confirmation feels important. Okay, one last area. What about family members or caregivers? What role can they play?
Oh, they can be absolutely vital, especially for, say, elderly parents or relatives or people dealing with chronic conditions who might find it harder to manage everything themselves. Caregivers can help make sure tests actually happen, maybe go with them to appointments, help with online consults if needed.
Sort of being an advocate.
Exactly. A second set of ears, an advocate. And just keeping an eye out, making sure symptoms aren't being ignored or that action is taken if results are abnormal. They can be so important in that whole process.
So wrapping up this deep dive then, what's the main takeaway, the core message for everyone listening?
I think the central point is that following up isn't just, ticking a box. It's a truly essential part of your healthcare journey. It's the step that turns information into action, into better health management.
And that really puts the onus on us, doesn't it? As listeners, as patients, to be informed, to be engaged, to make sure that loop gets closed.
It does involve that personal responsibility, yes. So maybe a final thought to leave you with. We know healthcare systems are complex, getting more so, and the number of tests is just going up and up. So thinking ahead, what kind of innovative solutions could we maybe implement to make sure follow-up is seamless, timely for everyone? How do we move beyond just individual effort towards building, stronger systemic supports? Maybe using technology better, maybe refining the protocols we already have? Something to think about.